Hi everyone, welcome to today's Mental Health Awareness segment brought to you by Los Angeles County Department of Health. I'm Dr. Nina Tayyib and I'm joined by Dr. Hanu Damerla. Today we're going to talk about post-traumatic stress disorder, otherwise known as PTSD.
Post-traumatic stress disorder, or PTSD, is a mental illness or a mental disorder. It happens in response to an extreme stress or very traumatic situation. In life, we are faced with stressors all the time. There are those stressors that just involve a life change, but there are those stressors that really threaten us with death and other horrific circumstances. PTSD, or post-traumatic stress disorder, happens as a result of one of those traumatic incidents, such as an accident, or the veterans that face combat, or severe abuse that people suffer. So as a result of this, PTSD can present with various types of symptoms.
So with PTSD, there's 4 major signs and symptoms. The first one is what we call hypervigilance. And this is when a person is just very keyed up. They're on edge and their mind is constantly thinking about what's the next bad thing that's going to happen to them. A lot of times, unfortunately, people have a lot of trouble coping with this hypervigilance. So sometimes they do turn to drugs and alcohol, which can turn into an addiction. A second sign is avoidance. So a traumatic thing just happened to somebody, and so they want to do whatever they can avoid thinking about a situation that may remind them of that tragic event. A third symptom that someone can experience is what we call flashbacks. And that's an experience when the person feels literally that they're actually going through that same traumatic event again. This can happen while they're awake, and sometimes it's triggered by a sight or a sound, or it can sometimes happen when they're asleep with some really severe, serious nightmares. And then the fourth sign of PTSD is a general negative feeling about themselves and the world. The world has now become a very scary place where people can't be trusted. And often people describe feeling very numb and sometimes very shameful and feeling guilty. They're feeling like they're out of control. They don't know what's going on, so they assume that it's their fault. And this is where it can go to a really dark place, which is what we want to avoid, which could be depression or even thoughts of suicide. The signs and symptoms of PTSD, it may happen right after the event, or it may happen, later down the line, even weeks or months. But what's important to remember is that if these signs and symptoms are experienced for 4 weeks or longer, and it's affecting their lives, it's affecting their relationships, it may be important to see if mental health treatment is needed.
Post-traumatic stress disorder can happen in children and adolescents. There are several types of trauma: physical and sexual abuse, neglect, and various other kinds of trauma. PTSD is difficult enough to diagnose in adults, leave alone kids, children and adolescents. They're not mature, they're not able to process and comprehend everything that's going on. So needless to say, they express this disorder in a very different manner. For example, little kids express it as fear, intense fear when their parents leave them, or intense fear and acting out behavior when they're exposed to a cue that reminds them of the traumatic incident. In addition, they can have severe problems such as being afraid of going to school. They may avoid interactions with things that they enjoy. They may avoid friends and other relatives that they normally enjoy hanging out with. So there are several pointers. When kids cannot express their symptoms, they usually bring it out in their play. When you realize that a kid is acting too aggressively or is playing in a very aggressive manner, I think imperative to try to explore that further. The other issue is they can express different symptoms at different times. So these are the complexities of a growing child whose brain is still forming.
Thank you for joining us for today's Mental Health Awareness segment. We hope that you learned something about PTSD and how trauma can affect your mental health. Please know that there's help out there and there's always hope for things to get better.
If you or someone you care about needs help, call the Los Angeles County Department of Mental Health 24/7 helpline at 1-800-854-7771. Your call is safe and confidential.